Hi, my name's Sam White. I'm 33 years old. I have bowel cancer. So life before my cancer diagnosis, I was living in Sydney in Cronulla. I was surfing 4 or 5 times a week, living quite a healthy sort of lifestyle with going to the gym and things like that. I started to get some sharp pain in my abdominal area. That first showed when I was surfing, so I first assumed that it was a surfing injury and I just needed some rest and some painkillers and anti-inflammatories to sort of get that better. And then I'd booked flights to Adelaide, and then I started to get some more symptoms like really tired, some nausea after eating, and it just wasn't really sitting right with me. And so that's when I went and got checked out and went through a lot of scans and all that, and that's when they found tumours and led to the diagnosis of bowel cancer. The diagnosis made me feel quite surprised really and shocked. I'm only 33 years old. Certainly wasn't expecting to have something like this in my life this young. So that was quite difficult to really hear those sort of words come out of the doctor's mouth, and then sort of didn't really understand it at first. It was sort of like I just assumed I'd be going back to Sydney after a few weeks and all that, but then it really started to sink in what that actually meant for me and my family to go through. So life for me at the moment, I've moved back to Adelaide. I'm living with my parents and my brother. It's been good to have that support and close family around me to sort of get me through the cancer treatment and just deal with the ins and outs of cancer and all that. It's helped me with my emotional sort of side of things and my mental well-being. I have an appointment with my specialist to see how I'm going with a blood test, just to make sure my body's able to cope with the chemo. And then I go for an afternoon of having chemo, and then I have a bottle that I have with me for 2 days at home, and then I have that disconnected, and then I have sort of 10 days where I'm off chemo, my body's recovering, and then come in 2 weeks later to start chemo again. So I first heard about LIFT at my first appointment here at the Icon Cancer Centre where I have my treatment. They said that there was a clinic downstairs that supports cancer patients to sort of deal with cancer. So exercise medicine has helped me with my cancer treatment through a number of ways. First of all, I'd always sort of enjoyed going to the gym, and that's really been helpful to get back to something that I was doing before I was diagnosed with cancer. It's also given me sort of an outlet. A lot of what I've dealt with cancer is it's out of your control. You've just got to get through it, do the treatment, go home, and then come back and have the treatment again. This has given me something that I can physically focus on that will contribute to my success with cancer treatment. And the other sort of major benefit of exercise medicine is that it is very effective at suppressing side effects from chemo. I felt a massive difference between when I've done exercise in between treatments and when I haven't been able to. I've felt a lot less side effects when I've been able to exercise. So the services here at LIFT that I've been able to make use of is the psychologist. She's been very helpful for me, particularly when I was first started at LIFT. I was able to sit down and sort of talk to someone that sort of is specialised with oncology and cancer patients, just to really open up, how I'm feeling, and just sort of hear her feedback and sort of her help towards, sort of managing the mental well-being side of things, because that is a big part of cancer treatment, is the mental well-being side. The other services I've used is the dietitian, so to really come up with a sort of diet plan for myself to really help support my cancer treatment and make sure I've got energy and that for the exercise sessions that I've done here. And the other services I've made use of is exercise medicine, with the exercise physicians really come out with a specialised program for me and then sort of pushing me in the gym and keeping me on the right track. So the message I have for other young patients dealing with a cancer diagnosis is mental wellbeing is a big part of the journey with cancer. It's not just the health side of things. It's a very challenging thing to go through and a lot of uncertainty. So focusing on some strategies that you can use to deal with that is definitely very helpful. And just being close to family and just being open to talk to your family and friends about how you're feeling. If you're feeling down, talk to them. I found that just talking about it really helped me get through things, and just trying to remain as positive as you can be, but also accepting that there is a lot of challenges mentally going through something like this. In terms of the general community and making the most of life, and what I'd sort of recommend, having gone through what I've been through, is really to live your life, know what's important to you, and make sure you prioritise those things. And at the end of the day, you just don't know what's around the corner for you. So really making the most of your time that you have, making the most of your health, knowing what's important to you and what you're not willing to compromise on. My wish for the future is to beat cancer, get back to sort of the life I had before, to surf, be around my family and friends. I've spent a long time in Sydney away from family and friends. So I'm just, really wish to beat cancer and to spend more time with family and do the important things to me, like surfing and being around nature and all that.
He's got that nailed, hasn't he?
He has.